Hey everyone, and welcome to today's Explainer. I am absolutely thrilled to have you here today because we're going to tackle something that literally almost every single person, especially if you're a parent, is going to deal with at some point. We are clearing up one of the biggest medical misconceptions out there. I'm talking about the ultimate throat misconception, sore throat versus strep throat. Now, it sounds simple enough, right? But the nuances here literally dictate whether you should just stay home on the couch drinking tea or if you urgently need to get to a doctor. So let's jump right in.
It's just a sore throat. I mean, we've all heard it, and we've probably all said it. It's such an incredibly relatable thing to say. When you or your kid wakes up with that awful, scratchy, painful throat, your very first instinct is to just downplay it, to assume it's just a minor annoyance that's going to pass in a day or two. But I really want to raise the stakes right away here, because sometimes it actually isn't just a sore throat, and honestly, assuming it is can lead us down a pretty dangerous path.
Because here's the reality we really need to confront. If that sore throat is actually a very specific type of bacterial infection and it gets treated wrong or just ignored altogether, it can lead to some severe, hidden physical consequences. We're talking about potential damage to the heart, to the kidneys, and even to your joints. So it transforms from just a simple throat ache into this massive systemic threat to your entire body. Getting this distinction right isn't just about feeling better for a few days. It is absolutely crucial for protecting your long-term health.
Okay, let's dive into this. Section 1. The ultimate misconception, symptom versus disease.
This is the paradigm shift that's going to make everything else we talk about today totally click. You see, TV commercials, casual advice from friends, even sometimes hasty medical advice, they constantly mix these two concepts up like they're the exact same thing. But they aren't. A sore throat is really just a symptom. It's a description of how you feel, and usually it's viral. Strep throat, on the flip side, is a very specific disease caused by a specific bacteria. It's a symptom versus a disease. Equating the two is exactly where all the trouble starts.
The really crucial thing to remember is that most sore throats, especially when we're talking about kids, are caused by viruses. Your common culprits are colds, influenza, COVID, and RSV. So why does this matter so much? Well, because when a virus is the root cause of that pain, antibiotics do absolutely nothing. Zero. They literally cannot kill a virus. In those typical cases, your immune system just needs time to do its thing, and most of these viral sore throats are going to naturally clear up on their own in about a week.
Moving right along to Section 2, Identifying True Strep, the warning signs. Let's look at what we actually need to watch for.
So, true strep throat is an infection caused specifically by group A Streptococcus bacteria. And unlike a viral infection, this bacteria aggressively targets your tonsils. Let's just walk through this symptom checklist together. You're looking for really severe throat pain, sharp pain when swallowing, a sudden fever, swollen tonsils, and visibly white patches or streaks of pus on those tonsils, along with swollen, tender lymph nodes in the neck. Why does this matter? Because this cluster of symptoms is your body waving a massive red flag, signaling a bacterial attack that requires a specific medical counterattack.
But honestly, out of all those symptoms, this next point is arguably the most fascinating clue of all. No runny nose. No sneezing. This is a huge, huge diagnostic clue. If a child's throat is in agonizing pain, but their nose is perfectly clear, that one single detail immediately shifts the medical suspicion heavily away from a common cold virus and straight toward true bacterial strep.
All right, let's hit Section 3, Debunking the Cold Myth, Fact versus Fiction. Time to clear away some old wives' tales.
I mean, read these with me. I drank cold water. I ate ice cream. I got cold. That's why I got strep throat. We've all heard these, right? Heck, maybe you've even believed them. It's totally human nature to look for a cause and effect relationship right before we get sick. You go outside without a jacket, your throat hurts the next day, and boom, you immediately blame the weather or that cold glass of ice water.
Actually, scratch that. Let's look at the actual medical reality. Strep throat is an infection caused solely by streptococcal bacteria. It's not caused by temperature. It is absolutely not caused by cold exposure. Ice cream doesn't create bacteria. Cold drinks don't create bacteria. Walking outside without a scarf doesn't just magically spawn group A strep in your throat. Now, sure, getting really cold might slightly lower your immune defenses for a bit, but it cannot create strep out of thin air. You literally have to catch the specific bacteria.
Now, what's really interesting about this next slide is how it frames Section 4, the double-edged sword, the treatment stakes. This right here perfectly captures the ultimate medical dilemma.
On one hand, you've got the terrifying dangers of untreated true strep, rheumatic fever, heart valve damage, kidney inflammation, and joint disease. These are intense, severe complications that the right antibiotics will prevent. But on the flip side, if we just hand out antibiotics for every single viral sore throat that comes along, we are directly contributing to bacterial resistance, which makes future infections so much harder to treat for everyone.
And because of those massive dual dangers, doctors don't just guess. They rely on some incredibly safe, specific approaches to distinguish viral from bacterial before they even think about writing a prescription. Step 1 is just careful observation and clinical assessment. Step 2 might be a throat swab. And Step 3 is using a rapid strep test. These tools are quite literally the shield against both the dangers of untreated strep and the global danger of antibiotic resistance.
And this brilliantly illustrates Section 5, Cure versus Comfort, Treatment Truths.
Look, when you're sitting at home feeling totally miserable, supportive treatments like saltwater gargles, warm teas, lozenges, and throat sprays are amazing. They significantly reduce your discomfort and just make life bearable while your body fights. But, and this is a massive but, they do not eliminate streptococcal bacteria. They are purely for comfort. Only appropriate prescribed antibiotics can actually eliminate the bacteria and prevent those severe complications we talked about earlier. Bottom line, comfort does not equal cure.
Let's bring it all together with Section 6, When to Seek Care, the Action Plan.
So, here is your ultimate cheat sheet to take away from this explainer. If it's likely strep, meaning you need a prompt evaluation, you're looking for that severe pain, a high fever, white patches, and crucially, no runny nose. But if it's likely viral, meaning you can generally just keep an eye on it at home, you'll see a runny nose, a cough, watery eyes, and milder pain. Keeping this contrast in mind gives you the clarity to assess the situation without panicking.
Which brings us to a final, really provocative question to leave you with today. Are you guessing or are you diagnosing? Never ever ignore a true strep throat, but always keep in mind that the vast majority of sore throats simply do not need antibiotics. The right treatment depends entirely on the right diagnosis. So when in doubt, don't just assume based on a scratchy throat. Let a healthcare professional run the tests so you can know for sure. Thank you so much for joining me for this explainer today. Keep this knowledge in your back pocket for cold season, and as always, stay curious.